My name is Terry Mamounas. I'm the medical director of the Comprehensive Breast Program at Orlando Health Cancer Institute, and I'm a breast surgical oncologist by training. So the question is, do breast implants need to be replaced every 10 years, and what are some of the indications for replacing the implants? Well, on average, today's implants are designed to last more than a decade, with a chance of rupture actually increasing by about 1% every year. So the older the implants are, of course, the greater the risk of rupture or other complications. But in many cases, breast implants can remain in good shape for 20 years or more. In fact, I have patients that had implants for 30 years and they look fine, and there's no problem at all. Of course, it is important for patients to follow the plastic surgeon's guidelines for annual checkups and regular self-checks by the patient. For silicone implants, the FDA recommends getting an MRI 3 years after the initial surgery for the implants, and then every 2 years after that. Patients not necessarily always abide by this calendar, but in general, I think that's a good recommendation. And of course, taking care of the implants can help extend the life of the implants before replacement is required. Now, what are some of the indications for replacing implants? Well, there are several reasons why an implant may need to be replaced. Obviously, an implant infection would require the implant to be removed and replaced. Implant rupture, that can again be identified for silicone implants usually by MRI. Usually, otherwise, you don't know for sure. So the MRI is the best way to document rupture for silicone implants. If you have saline implants, I think if the implants are ruptured, then eventually the implants deflate. So that's very obvious to the patient and to the physician that the implant has ruptured because it becomes flat. In other reasons are persistent pain. Some patients have persistent pain and tenderness around the implants, or also firmness of the implant is another reason why sometimes the implants need to be removed, as well as asymmetry between the two breasts, or sometimes implant wrinkles, what we see, and sometimes the patients don't like the cosmetic results and have the implants removed or replaced. Another reason to remove implants would be to correct what we call the animation deformity, which can occur when implants are placed behind the pectoralis major muscle. And every time the muscle contracts, then the muscle shrinks the implant and causes what we call the animation deformity. And patients obviously don't like that. Now, in this case, what we typically would do, implants will be removed and then placed prepectorally, put the implants in front of the muscle. And in fact, in recent years, there's a continuous increase in the use of prepectoral implants versus the postpectoral implants, because they have an advantage also, besides getting rid of the animation deformity, have an advantage of less postoperative pain and easier postoperative recovery. So prepectoral implants are becoming now rapidly the standard of care for most plastic surgeons to use. And lastly, a rare reason for removal of an implant and its capsule is the development of an entity that is called implant-associated anaplastic large cell lymphoma. This is, of course, a rare entity. It's very uncommon, but it usually presents as peri-implant effusion in a patient who usually has texture implants. It's more commonly seen with texture implants versus the soft, flat, smooth implant. So this is usually an indolent lymphoma that is typically cured by surgery that requires, of course, complete removal of the implant as well as the capsule around the implant. So that's a very rare reason of removing the implants, but nevertheless, patients should be aware of that if they notice an increase in their implant size, which is typically an effusion around the implant. They should report that to their plastic surgeon.